Thank you kindly. Good afternoon. You all look like a studious group out there today. You had a good session, I trust. I'm honored to join you and spend a few minutes talking about the issue of health care with some specificity on the issue of obesity and prevention. But look forward to your questions and hopefully give you a perspective on what we might be able to expect with a new Congress that is to be elected in 14 days. And regardless of what happens with that, it will be a different makeup, clearly. From my perspective, from our perspective, my team's perspective, we believe that American people want some checks and balances in place, and I think that's probably what's going to happen. That'll change significantly the dynamic as it relates to the discussion on health care. As was mentioned, I represent the 6th District of Georgia, northern suburban Atlanta, from here north, basically. North DeKalb, North Fulton from the perimeter north, all of East Cobb, and then all of Cherokee County for those of you who live in this area. It was Johnny Isaacson's district before I ran in 2004. And before that it was Newt's district. Newt represented the 6th District from 1978 to 1999. I'm in my third term, as was mentioned, serve on financial services and education and labor, and serve as the senior Republican on the Health Subcommittee on Education and Labor. So, such as the health care bill was that went through Congress, it went through went through our committee, and we had some significant jurisdiction over that. I guess before I begin, I would just ask how many folks are interested in politics. Get almost every hand out there. You know, it's interesting when I talk to many groups and ask them if they're interested in politics, whether it's students. I like to talk to a lot of student groups, or on through our entire society. Most often you get very few hands raised. You all are obviously very wise because you know that the next line that I was going to give is that if you don't think you're interested in politics, whatever you're interested in politics. And especially in your field and in your business, politics has so much to do with what you are able to do, how you determine what you're able to do, what the rules are going to be, how you're going to be able to be successful in whatever endeavor it is, what the role of politicians, and the role of government is going to be, which is I think an important thing to talk about as we talk about the whole issue of obesity. And you all know the numbers much better than I. I know that Dr. Kessler just spoke with you, and I'm sure he relayed to you some significant challenges that we have in the area of obesity. But I thought I would just share with you a few numbers that I have, some from the Congressional Budget Office and then some from the CDC. I know there's some folks here from the CDC. As it relates to obesity, Congressional Budget Office from 1987 to 2007, the fraction of adults who were overweight or obese increased from 44%, which was amazing in 1987, clearly, but to 63% in 2007. Almost two-thirds of the adult population now falls into one of those categories. The share of obese adults rose particularly rapidly, more than doubling from 13 to 28%. Health care spending, again from the Congressional Budget Office, health care spending per adult grew substantially in all weight categories between 1987 and 2007, but the rate of growth was much more rapid in those defined as obese, and that's a body mass index of greater than or equal to 30. Again, from the Congressional Budget Office, spending per capita for obese adults exceeded spending for adults of normal weight by about 8% in 1987, and in 2007 by 38%. So you see significant increases in the amount of spending. And then from the CDC, as it relates to childhood obesity has more than tripled in the last 30 years. Prevalence of obesity among children aged 6 to 11 increased from 6.5% in 1980 to 19.6% in 2008. And the prevalence of obesity among adolescents aged 12 to 19 years increased from 5 to 18.1% in that period of time. In a population-based sample of 5 to 17-year-olds, 70% of obese youth had at least one risk factor for cardiovascular disease, which is remarkable when you think about it. And obese youth, as you well know, are more likely than youth of normal weight to become obese as adults, and therefore more at risk for heart disease, type 2 diabetes, stroke, cancer, osteoarthritis, and all those other grand things that are side effects from obesity and lifestyle. So the premise that is the challenge, the problem of obesity, is huge. I mean, there's no doubt about it. The facts of the matter are very clear. The question is, what do we do about it? And what should the role of government be? And I guess if I had a take-home message, I would suggest to you that the role of government, as it increases in this area, probably is not the wisest thing for our society. And let me point to a couple examples of that, and then share some of my thoughts about where the solutions, in fact, do rest. And then I look forward to your questions and issues. If you think about the role of the federal government in something that it has poured trillions of dollars into, trillions of dollars over the last 40 years, and that is the war on poverty, literally trillions of dollars, what we have seen over the last 40 to 45 years is no change, zero change in the level of poverty in this nation. And so you got to ask yourself, why is that when the federal government has been involved in that for 45 years and literally spent trillions of dollars of your money? The second issue that I would point to as to why I'm concerned about the role of the federal government as it relates to obesity is the whole issue of quality in health care. And this has been front and center in this debate over the last 20 months, 18 to 20 months, as we went through the whole debate in Washington and the bill that was adopted. And the definition of quality of health care as it relates to whatever, you fill in the blank, I would suggest to you when we cede that to Washington, then we remove it from the clinical arena. We remove it from the folks who are seeing the patients, treating the patients, evaluating the patients in many, many ways. And let me point to a couple examples, because you may be sitting out there saying, well, you're out of your mind, you're crazy, these folks have the best of intentions and clearly the best of information, and they can do exactly, they ought to be able to be charged with doing exactly what we want them to do. You all remember as the debate was going on as it relates to health care, the whole issue of mammography that came up for women under the age of 50, and the recommendation came out that there wasn't any evidence that screening mammography for women under the age of 50 had any benefit in detecting or the treatment of breast cancer. And I want to raise this issue because not to talk about the clinical aspects of that or the credibility of that or the veracity of that statement, but about the response of the politicians when that came out. You'll remember this, it was 8, 10 months ago, 12 months ago. And as you'll recall, what happened in the House of Representatives and in Congress was that people ran around as fast as they could to say, oh no, that doesn't mean that we won't force insurance companies to cover screening mammography for women under the age of 50, right? Because we all know, that was the line, we all know that has to have great benefit. Now, I don't know whether it does or not, but I do know where you find the answer to that, and that is in a scientific arena. That is in the clinical arena. That is with individuals who are educated and trained to make those decisions. I like to say that the healthcare decisions ought to be made between patients and families and doctors. That's where the level of quality comes when we trust and are able to select the individuals that care for ourselves and for our family. But in this instance, the federal government came out with the guideline, with the recommendation, right? No screening mammography for individuals, for women under the age of 50, because there wasn't any cost benefit to it. And the politicians ran around as rapidly as they could to say, oh no, don't worry about that, we will force insurance companies to cover screening mammography for those under the age of 50, and that's what happened. So when we as a society cede the ability, the authority of Washington to make decisions in this arena, what happens is that we actually cede that authority, that power to us, to politicians. And I would suggest that that's not the greatest place for those decisions to be made. So whatever we can do as a society to put in place the rules that make sense from a clinical standpoint, from a treatment standpoint, from a medical standpoint, from a health standpoint, that make certain that the decisions that are being made are where they ought to be made, and that is with individuals who are closest to the folks being treated for whatever the diagnosis or the malady might be. The other item that I would point to is the whole issue of, again, that definition of quality in Washington as it relates to the health care legislation that was passed. The Comparative Effectiveness Research Council, that was an entity that was stood up and a 15-member board appointed to that. Not a single actively practicing physician on that board. These are individuals that are charged with determining what quality is, and when they determine that something in the community occurs by a provider or a physician or anybody caring for a patient is not quality in their definition, then what is their punishment for the individual providing that care? It's not to pay for it. And so you get these incredibly perverse incentives for individuals to treat patients, to care for patients, to treat diseases, to treat illness, to treat health in our community in ways based solely, oftentimes, on the costs. And I would suggest that we as a society don't want that. That's the wrong place for those decisions to be made. So what should we be doing? Well, I want to mention 3 specific items, and then again look forward to your comments and questions and concerns. The first is the whole issue of education. We can go a long way toward assisting the education of all in our society about a healthy lifestyle. We can provide significant incentives for local communities and the local school boards and districts to be able to provide appropriate education about what a healthy lifestyle is. Because ultimately, don't we want individuals to be incented and have the knowledge base to be able to say, yeah, that's good for me, no, that's bad for me, I'm not gonna do that. That's ultimately where the wisest decisions will be made. So education is I believe, a huge component of all of this, and not just education for the individual, but education for the folks who are providing health coverage, which leads me to the level of insurance and some of the successes that we have seen out there in the community. The Safeway model, many of you may know about the Safeway model, that has in fact provided incentives for employees of the Safeway company to do the right thing as it relates to their own health. So whether it's making certain that they have the screening exams, making certain that they quit smoking, that they take their hypertensive medication, that they have the checkups that they need, that they keep their weight in order. All those kinds of things that we know are helpful to a healthy lifestyle. Their employees are actually provided financial incentives through the private sector to accomplish those ends, to accomplish those goals. And what they have seen is a significant improvement in the health status of their employees. And so there are wonderful ways to be able to try to make that happen through the private sector. And then finally, I think the whole discussion that is the 60,000-foot level, and that is what is the role of the federal government and what is the role and responsibility of the individual, we need to have that debate. We need to have that discussion. Because I think that if people seriously have an adult, sober conversation about that question, what should be the role of the federal government in these kind of challenging issues, that the vast majority of the American people will say they believe that there is a role. Maybe it's incentivizing, maybe it's education, maybe it's some other things that you all know much better than I. But is the role to be prescriptive in what kind of specific products are out there in the market, what kind of specific activity that an individual must do, what kind of specific rules and processes that individuals must follow, or, remember there's that or always, what happens then? And that's the whole debate that we're having right now as it relates to the provision of health coverage, that the penalty for not having health coverage is a tax penalty for individuals, and the question of whether or not the federal government can actually do that from a constitutional standpoint. So, remarkable challenges, but exciting times, clearly. Exciting times because I think that we have not engaged in the community in ways that we have been that we may not have seen the opportunity to do so over the last number of decades. Some of you are old enough to remember President Kennedy and the Presidential Fitness Program that he instituted. I was a kid in elementary school during that period of time, and that was a program that cost no money at all, virtually. But I promise you that me and all of my classmates worked as hard as we could to make certain that we could do whatever it was, 30 push-ups and 20 pull-ups and climb to the top of the gym on a rope. and run the 100-yard dash under an appropriate period of time, so that we could get the presidential fitness badge, and that cost the federal government nothing, and it was those kinds of incentives that I think we might want to seriously consider revisiting. So with that, let me thank you again for the opportunity to be with you and share a few words. I look forward to you teaching me as much as possible over the next 10 to 15 minutes in the Q&A session, so that I can hopefully return to Washington a smarter guy as it relates to your issues. Thank you so much. God bless you. Yeah, way in the back.
What would have been your position in terms of the government's role in anti-smoking legislation, a few decades back? Do you think that was a good thing or a bad thing? Do you see that was an appropriate role for government at that time?
I think when I had a hand in that here at the state level. I was in the state senate for 4 terms, and we dealt with non-smoking or legislation that precluded the ability of private businesses to allow smoking. And I think when government sets a level playing field for everybody and equal rules for everybody, then it makes some sense. The whole issue of smoking, though, I think is one that at some point has some libertarian aspect to it. I'm not certain that we want to, as a federal government, say to an individual, you cannot smoke. I think at some point you've got to have the ability of individuals to make decisions for themselves. And we can have a government that dictates to people exactly everything they must do. You got to run around that track 2 times each day, or we're going to tax you or punish you or whatever we're going to do.
Yeah, no, but I was talking more, they did some very specific things in terms of outlawing cigarette advertising on television, putting warnings on packs, and we've seen the rate of smoking go down dramatically since those things happened. So it seemed to me, anyway, that was kind of an appropriate action. I'm wondering whether we might also think about, well, gee, if we know other things are damaging to people, isn't there some responsibility for government for the greater good to lead the way in those respects? Say, some sort of fast food, for example.
Yeah, and I think that's the education process. I do indeed. And
it's not the education process. That's actually only one small aspect of it. It was also a regulation that was put in place that said you cannot advertise these things in this way. It wasn't just education.
Yeah. I don't know what I would have done. But I think the education is incredibly important, because the education of individuals who understand and appreciate the consequences of these adverse activities, smoking being one. I mean, I lost my dad to smoking. He died of emphysema. He started smoking in World War II. He died of lucky strike lungs, I call it. And I don't know that all those guys would have done that had they known the consequences at that time. I think one could make a pretty good argument that wasn't the case. At that time, the government was handing out cigarettes, as you well know.
Just a comment, your position about, I know this is about obesity and we're talking about smoking, but you were talking about libertarianism and not being able to tell people not to smoke. You acknowledge that the experience of smoking is not particularly self-contained, that you've already inhaled someone else's smoke by the time you realize you're walking behind a smoker.
Sure.
Okay.
Yeah. In fact, I'm amazed now. We're so, I grew up in a household that had smoked, because my dad smoked, and I smoked through college. But I'm amazed now at how much you can tell somebody in the next car is smoking. Have you noticed that? I'll pull up at a stoplight and have somebody smoking in the next car, and you can smell it. It really is phenomenal. Yeah, so you're absolutely right.
I guess just a follow-up comment to one of the comments made back there about the regulatory environment, because I'm just curious, because there is obviously that back and forth about education and the role of the individual in making her or his own decisions about their own health. But on the other hand, in the public health community, we know that the biggest changes, the most dramatic changes to improving life in terms of the length of life and the quality of life is through the legislative process, which enables a healthy environment for which people, educated or not, by the way, to make decisions. So that's the case with smoking. It's the case with various other places, vaccinations, public health, various public health successes. So I'm just curious I'd like to hear you say more about that, I guess.
Well, I mean, clearly public health was you all know more about this than I, but public health was one of the great advances that allowed for the extension of the length of life. in the 20th century. I mean, all the clean water and clean communities aspect that resulted in significant improvement in the quality of life. I mean, that's a perfectly appropriate role. But I think at some point you bump up against something that says, you know, maybe this is a step too far. I don't know where that line is. I mean, I honestly don't. I'm not dogmatic about this. I think that I am dogmatic about the belief that we ought to have these decisions be made by scientists and clinicians and folks trained in the field as opposed to politicians. I think having the Congress vote on whether or not, in response to a government report, that mammography ought to be required of insurance companies to cover under the age of 50 as a screening exam, diametrically opposed to the recommendation, I think that's probably, that becomes a political debate that I think, I know the fund of knowledge in Congress isn't there to make that decision. So that's what I mean about a step too far. Yeah. Sure.
Quite a bit of data supporting ethical and regulatory environments surrounding whether it's food or vending machines or whatever it is that are going to enable people to make healthy choices. So what would be the venue then for convincing someone like you that actually the science doesn't exist?
Well, I think that the decisions that are made closest to the people are the most responsive. So that, for example, vending machines selling sodas in school. I think that's an appropriate discussion to have at the state and the local level. And if local communities or local boards of education or local legislatures, state legislatures, believe that that's not something that they want in their state, then I think that's probably a constitutional activity for them to preclude. I'm not certain it is for the federal government, because I know that once you make those decisions at the federal level, the likelihood of having them modified or changed in a positive way based upon a change in knowledge is less than rapid. And if you don't believe that, I'd point to Medicare Part D, prescription coverage in Medicare. We had Medicare exist for 40 years before you had any prescription coverage for seniors in the Medicare program. That's because of Washington. That's not because people decided that prescriptions weren't helpful for seniors.
Okay. But it seems to me that the cost curve that we've got, as long as patients you either have a free market where patients know what they're paying, know what's coming out of some fund or some subsidy or whatever, but they know that there's their money being spent, or you have this other system where the government takes care of you and you're going to get rationing because there's no other way around it. So I guess I'm confused about, again, in the next 5 years, what's going to happen? I mean, if this current law is not going to work, then what do we end up with as a country?
I think it gets worse before it gets better, because the law and the bill itself are not they're not workable. They weren't meant for people. It was meant for the federal government to have greater control over what's going on in the healthcare arena. So it'll get worse before it gets better, and when it gets better, I think it can get a lot better as we rewrite the rules that govern how the process works, how you deal with whoever it is that you deal with when you're deciding what to do in the area of obesity or nutrition or whatever it might be.
I'd say we have time for one more quick question, if anyone else has anything.
Bring it back to obesity prevention.
Yeah.
2 questions. Have you followed at all New York City and their banning of trans fat? And if you have any thoughts on that. And secondly, what you think about Michelle Obama's Let's Move campaign?
The New York City issue, just peripherally, and so I don't have any great knowledge about how that is working or has worked or what the challenges that they've had. In terms of the Let's Move campaign, look, I'm one of those who believes that all kids ought to be having some type of physical education every day in primary and secondary levels. I mean, I just think that our kids are much too sedentary. You don't get the numbers that I described and that you well know without some significant change in just habits of individuals. We haven't changed as a species that much in 30 years to get this kind of dilemma. One of the only things that I think makes a whole lot of sense, or when I look at these young people and young people 30 years ago, 40 years ago, is their level of physical activity, which has gone down significantly. So I'm a strong proponent of an advocate for increasing physical activity for young people. I do believe that the location where that decision ought to be made is local, and so that local boards of education can determine aggressively what they want to do, and they ought to be given the latitude to do so. If we can ever help or answer any questions, let us know. We're just tom.house.gov, tom.house.gov. And if you think I'm absolutely crazy, then send me a couple links to something that you think might edify me and allow me